I think it's a shame that stigma would ever make someone not try a medication that would really benefit them. And all of these sort of anti-cannabis stories and propaganda that you've heard, just sort of put that all to the side and try and do your own research with existing patients, I would say.
Hi, everyone, and welcome back to Harmonia Podcast. We are joined here today by the lovely Josephine, a medical cannabis patient and advocate. Hi, Josephine.
Hi, Berta.
How are you?
Not bad, thank you. It's quite rainy here, but it's been a very chill week. I had no idea that there was Easter weekend coming up, so it's brilliant for me.
It goes to show that we work too much. I didn't even realize that either.
It's definitely well deserved.
Definitely cannot wait. So Josephine has joined us today to talk about her experience as a medical cannabis patient. But before we go into that, I'm going to hand over to Josephine so she can do a more formal introduction.
Yeah, thank you. So my name is Josephine MacFarlane. I've been the marketing lead for Grow Group for about a year and 8 months now. I started working for Grow right out of uni, and before that, in my placement year, I worked for a CBD company. So I've been in cannabis since I left uni and during uni, so a long time. Um, but yeah, I specialize in cannabis marketing, and I did a dissertation on how to destigmatize cannabis and other newly legalized medicines and products through marketing.
Wow, amazing work, amazing work. And as somebody who has only half read the dissertation because I totally forgot to go back to it. No, it was amazing. It was absolutely amazing. And actually, do you want to tell us a little bit more about some of the findings that you had before we go into your patient experience? Because I really feel like you captured so much in that dissertation.
Yeah, of course. So I used the SOR model to look at attitudes towards cannabis, specifically CBD. I used partially because it's a lot easier to get approval from the ethics board to do something about a product versus a medicine. And so using the SOR model, which is stimuli, organism, and response. And so the stimuli is the packaging, the cannabis leaf itself, all sort of visual information about cannabis. And the organism is the internal processes that happen while you're looking at it. So it might be the stigma, the internal sort of cognitive negative dissonance between who you think you are and the thought of like a stoner stereotype, and all of these different things that come up when people are considering whether or not they want to try it, and then the response is wanting to try it or not wanting to try it. And I had a lot of different results based on that, and different insights. For example, the main deciding factor of the different levels of stigma was age. And so the older people had a lot different responses to seeing cannabis versus younger people that were a lot more open minded. But it was kind of like a bell curve where the much older people, when they have more chronic conditions and more reasons to try cannabis, they were becoming much more open minded because they'd kind of run out of options, and it's getting to late in life where you're looking for that sort of quality of life improvement and not just treatment. But yeah, that was the main finding that I found out that I thought was really interesting.
No, I agree with you. I think it's very interesting too. And I think within just the medical cannabis sector, full stop, one of the criteria is before they've changed the criteria back in like September or something to just unmet clinical need. But prior to that, it was you need to be able to evidence that you have tried conventional methods. And I can imagine with the older ones that have tried so many different things and have run out of options, at that point, you will try anything. So it's funny how your health determines what type of medication you will try. Um, so I found that really interesting, anyways. But I just thought that it was something that was really important to share here. But before I digress, let's go back to you as a patient. So, what sort of, I suppose, motivated you to, I suppose, trial a different type of medication for your healthcare? You know what? Let's just hear your journey.
Yeah, of course. So I've taken CBD oil, like high street CBD oil, since I was about 15. I think it wasn't massively legal when I was 15, but it was still sort of sold on the high streets at that age for me. And I started taking it because I was getting some quite bad anxiety related to sort of GCSEs and A levels. And I was having quite bad stomach issues, and I know now that a lot of my stomach issues were anxiety related. So I was taking Buscopan and paracetamol, I guess, and different stomach things. Like I was prescribed peppermint oil by my GP for my stomach, but it turns out that I had GERD as well, like stomach acid. So that kind of made it worse. So when I found or started using CBD oil, it really helped with kind of all three of those things: the anxiety, the stomach issues, and the GERD that I was having. And I wasn't really aware of medical cannabis itself until Grow contacted me. So I was headhunted by Grow because I made a cannabis marketing Twitter. I started talking about cannabis on Twitter during uni. Thank you. And then Alex, actually, my coworker Alex Fraser, the patient access lead at Grow, found me on there. But yeah, so I had no idea that I had that kind of misconception that a lot of people have, that medical cannabis is just for very severe conditions like MS and epilepsy, and CINV, things like that. Um, and I thought it was incredibly expensive, that it's really, really hard to get it. And I just had no idea. So when I was having these sort of initial calls with Grow, they were at the same time explaining the job and also the industry and how medical cannabis works to me. So in the time between getting offered the job when I was still in uni and the end of uni, I had to do a lot of research into medical cannabis to make sure I understood what I was getting into and learn more about marketing, etc. Um, so Alex, my coworker, suggested, if CBD oil works for you, and just high street CBD, not even prescription, then you should definitely have a look into uh, a proper prescription, because I was as well at the same sort of time later on in sixth form. I discovered, illegal cannabis to help me with the more sort of intense anxiety I was having, and I found that combined with the CBD oil was really helping with a lot of different symptoms that I have related to my autism. So I get like sensory issues, and yeah, I get quite overwhelmed at different times, like meltdowns, and having that combination of CBD and THC, it was kind of like the next level, and that wasn't even, prescription, either of those things. So yeah, I started off by just having an initial consultation, and it's been amazing since. Really, definitely, like, has changed my life in a lot of different ways. I But it's not been as straightforward as I thought it was going to be. I'm not discounting the process at all, and it's definitely, there's a reason why you have follow-up consultations. I think a lot of people don't appreciate that they're really important. So for example, at first I was prescribed quite high THC flowers and a balanced oil. And I think that the illicit cannabis I was using was actually a lot weaker than I thought. I'm from the southwest of the UK, sort of Bristol, Bath area, and I know in other areas like London and big cities, there's a lot of strong cannabis, but you know, whatever way it worked out, that the medical cannabis was a lot stronger than I thought. And so it was actually a bit too strong for me, even with lowering temperatures, lowering doses. It was just not as functional as I needed, especially with my job being quite sort of high demand. So I stopped my prescription, and then I went back to them, explained it, and I got prescribed 100% CBD, so 100% CBD oil and flour. But I wasn't able to afford it, so I had to go back again. Yeah, it's quite an issue, I personally think, in the industry, um, that needs to be solved, sort of better availability, better access. And so yeah, the third time I went back and I got prescribed sort of balanced flour and low THC, and it's been like, the Goldilocks medicine, like just right in between the two, and it's been amazing, really.
For starters, thank you so much for sharing. And as you were saying it, I just took a few notes because I'm like, okay, I want to talk about this, and I want to talk about that, and I want to talk about this. But the very first thing I wanted to mention actually is I'm exactly like you. Um, I was completely taken aback by how strong the medication can be. Yeah, and I'm like you, I have to have a lower dose. Like I just, balanced or lower is just the only way that I'm going to be able to function. And I actually find that when I have a lower strain THC, it helps me more with my symptoms than a higher strain THC. But don't get me wrong, when I am between 8 and 10 out of 10 pain, high strength CBD, that's the only thing that will touch me. But on an average day, like when you're trying to work and when you are, like, in the pain, but you don't need that volume of THC. I tend to find the balance is so much better. So I fully agree, which I think everybody's nervous system is different and everybody responds to medication differently. So it's really important for you to go there and try and figure out which one works for you, because if you were at the NHS and they were to prescribe you, let's say, citalopram, and citalopram didn't work for you, then they will trial you on fluoxetine or any other, you know what I mean, yeah. It doesn't it this is medication. The same principle applies here. So I'm really happy that you've actually said that, because it's something I always go on and on about as well. THC does not mean that the medication is better, it just means higher THC, that's it.
Yeah, it's something very interesting to me, and I think it's partially related to my autism, that I'm quite sort of sensitive to medicines in general. And recently, my coworker Alex on our podcast Grow Conversations was talking to Shauna Levy from Madame Mercer, which is a Canadian brand that's owned by her, focuses on women's health. She mentioned how in the Canadian market, she sees a lot of men pushing for very like the highest THC product, and what she's aiming for is pushing more sort of emphasis on lower THC and also higher CBD, sort of the more sort of balanced medicines. And I think that sort of variety of medicines for different patients, different needs is an area that definitely needs to be worked on, because yeah, everyone's got different needs.
No, no, I fully agree. And I'm not sure who this woman is, but amazing work. Yeah, amazing work. Because I do feel like nowadays the medication is just getting stronger and stronger, and it's like, guys, I don't need a high THC. I need a full spectrum.
Yeah, it's interesting. I think there's only, to my knowledge, 4 balanced flowers on the market. So it's yeah, and compared to a huge range of high THC products. So I do think that there could be more, and there's always room to improve, because there are so many different patient needs, in terms of composition, ratios, and also like the way you take it. That's something I really took from the drug science conference we were both at. The talk on forms was very interesting, especially about how some people aren't able to inhale, for example, and then it's you need completely different modes of administration.
Yeah, and again, I fully echo everything that you were saying. One of the other things that I found that was really good that you mentioned as well is I'm forever screaming and shouting about clinical input. And I know that people don't want to have to go and see a doctor every 3 months. I know when you've picked up illicitly, it's so much easier to just go to the corner, pick up, and then come back and use, and you don't have to do this whole every 3 months. But that means the clinical input is not there. And I love to scream and shout about medical cannabis is not a cure to to any disease. It is a symptom reliever. It will relieve your symptoms to enable you to actually do the stuff that you need to do to take care of yourself. And clinical input is really, really important because your doctor will be able to support you and guide you through that process. As much as some people don't really like that, if you are using it as medicine, then this area is actually very important.
Yeah, I think that's it's one area that I try and emphasize with people, that until you have that initial consultation, I think it's hard to see, for some people to see the value when they're like, oh, so I could get the same thing as on the street. Like, why would I bother getting medical? But being able to talk to someone that's an incredible specialist in your condition, is so valuable. You know, like for example, my doctor has given me advice on not just cannabis. He's recommended different supplements. You know, walks in the day that he thinks I should be doing more, and it's there's this kind of holistic, all encompassing healthcare thing that I really like about medical cannabis in the UK, and I didn't expect. But yeah, it's there's so much value you can get from talking to a doctor, especially over time, because things can change. Like what a medicine that worked for you before might not after a while. So yeah, the clinical input is so valuable, from all the doctors.
And I think the most, you just said something that is so crucial. Things can change. And I know even from this doesn't just necessarily mean for the worse. My health has improved. And as my health is improving, I've noticed that, not only do you need less medication, but I can now change my medication around because I don't need something that was so much more potent as I did at the start of my journey. And so I've been able to change my medications around, change to the cartridges, which before the cartridges did nothing for me. Whereas now they are actually effective because my health has improved. So just bear that in mind as well, is that not all change is negative. Some change is actually positive. And instead of having to be on copious amounts, because I had to be on a much higher dose, I'm coming down on my medication. I'm switching it around. And I mean, I'm absolutely in love with the cartridges. Like, I just find them so easy and handy to use, and you just put them in your pocket. And I have my power bank, so I can always charge it on me, and then you can just easily use it when you're in public, rather than having to sit there and grind and vape and stuff. And so yeah, just things can change. So I've got everybody at this point knows I've got ADHD on this podcast. So if I use, I will go off on one. Um,
That's fine. My friends, and I are all sort of similar. I think neurodivergent people flock to each other. Um,
exactly. You should hear me and my friends speaking to each other. We're like, and then people around us are like, what in the holy hell is going on?
yeah, it's so true. And yeah, one thing that I don't hear people speaking about much is how a lot of medical cannabis doctors, they aim to sort of have you eventually reducing your medication or stopping it, for example, which I do personally hope I can get to that point where I am comfortable enough. You know, for me and my symptoms related to my autism, I'm always going to have autism, I know that, but I do hope I can get to the point where I can manage it with just a tiny bit of cannabis or go periods without it. And um, I think that's something that a lot of people don't speak about. That they're not trying to make you take a medicine forever, like, but on the NHS, for example, it's not like they're trying to make you take a medicine forever, but there are these sort of protocols where it is normal to have someone on very strong medication for a very long time, and not review that. But yeah, it's it's interesting.
You're literally, this is just music to my ears. Nice. No, because I'm always forever, complaining about it on this podcast. So it's nice to hear somebody else saying the exact same thing that I'm always complaining about. And you're very, very nice. I tell it like it is. I am like, sorry guys, but this is what they do, right? They put you on a medication, leave you on it for 20 years, and no review, no nothing. The amount of patients that I have worked in, talking about my mental health work, and I would see them and they are completely sedated. And, they say that they've been locked up for 10 years. They've lost their quality of life because they're so sedated on their medication, and it's stripped their personality. And no matter how many times they go back to the GP to complain, the GP will tell them, well, you suffer with psychosis, so we need to give you this risperidone, and this is the only medication that you can use. Whereas, where is the holistic approach? Where is the talking therapies? Where is the reviewing of medication? If this person is saying that they have no quality of life, why aren't you reviewing other medications? Because I know that a combination of other medications can give the same effects that that medication is giving, and can be less sedating for that person. So no, I will never shut up about this. So thank you so much for flagging that. So just because I'm realizing the time now, but just so that we can start, like, I guess, rounding things off, I've just got, I suppose, two questions for you. And the first question would be, what kind of advice would you give to cannabis naive patients that are considering a prescription but are really, really nervous?
Sorry, I was just muted. So I would say that for cannabis naive patients, that first of all, looking at patient advocacy groups is brilliant, like Sanskara, like the MCPA, UPA. I think those organizations are brilliant to have people to talk to, and these kind of groups of people, forums, to chat to existing patients, I think is really valuable to address any concerns that you have, and also to get sort of first-hand experiences. And then I would also say to chat to clinics that you're interested in. Just have a call and ask them anything that you're worried about. Because there are so many people out there with the medical cannabis industry that are really willing to educate and willing to help. And yeah, I would say don't be afraid to try it. There are a lot of people are very comfortable taking very strong medications. I'm not anti-pharmaceutical traditional medications by any means at all, but a lot of people are very comfortable with taking these NHS prescribed medications, but very scared of medical cannabis. But it's been used for thousands and thousands of years, and I think that um, if you, I yeah, I'm trying to think of how to phrase it. I think it's a shame that stigma would ever make someone not try a medication that would really benefit them. And all of these sort of anti-cannabis stories and propaganda that you've heard, just sort of put that all to the side and try and do your own research with existing patients, I would say.
Honestly, that was fantastic. No, 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 no. Yeah, fantastic. I don't even have anything to add to that. So my next question then would be, what sort of advice or feedback would you give to now the cannabis industry in terms of moving forward, in terms of supporting us, I suppose, as patients?
Yeah, I think one phrase I really like to use about the cannabis industry is the silo mentality, where if you've been in something for a long time, you kind of forget how people see it that aren't in the industry. And I think putting yourselves in the shoes of people that have no idea will make you reassess the vocabulary you use. Because even the word cannabinoid and all of these, it's just they're all barriers to accessing medicines, the way you phrase it. And you know jumping straight to talking to experienced users and forgetting cannabis naive people. Yeah, I think that it would be good for the industry to be less insular, talk within each other more, because there's such sort of heavy competition because it's such an early industry. But at the end of the day, patients are the most important. And yeah, I think the focus should be on everyone getting together to do large scale marketing campaigns. Like, I really like the media pieces at the moment, things like Grow are doing at the moment, like working with the police to educate them. I really like pedestrianizing cannabis as well, like putting it on the high street with vape lounges, and obviously better accessibility, more access schemes in general. And then intersectional issues like bridging the gap for people without access to the internet, because it is very um, heavy on the digital services side. So yeah, I think focusing on things like achieving NHS reimbursement, making the process as simple as possible, and then other intersectional issues like coming up with a protocol for trans people that have different names on their medical records. All of these things, there are so many things that can be done for the industry to improve, for access to improve, and we need to start developing specific plans to address specific different demographics. I think, that's what I would say. Lots of different things, basically.
No, it's fantastic. Again, everything that you're just saying is music to my ears. Like, so thank you so much for that feedback, and I fully agree with you. There's only one thing I wanted to just mention as well. I mirrored that the names of these medications. If you want to take a medication seriously, calling it it's not.
That was that's something I've been chatting with my coworkers about recently. It is interesting. We did a survey of healthcare professionals with Go Pharma, and that was one of the findings, that the healthcare professionals were put off by strain names, and they thought it was sort of unprofessional and all of these things. But if you call the medicines different names, then patients will want to find out what the strain is anyway and will put it out anyway. And a lot of people use strains as a good indicator for what's helped them on from the illicit market, but sometimes not everything is the name that someone says it is. You've got people selling Stardog and calling it whatever else. um, so yeah, I'm not sure what I think personally, because I do like to know the strain. And some of the other arguments, for example, just using THC percentage instead, ignores things like terpenes, which is also controversial. Um, so yeah, I'm not sure. I personally think that changing and moving away from strain names, um, I don't think personally that the medical side needs to completely detach from the recreational side, because there is so much benefit that the legacy market brings, in terms of growers and in terms of knowledge, and these things like strain names. It's the same with trying to change terminology, like just trying to stop it being called medical cannabis. You can say what you want as a company, but people and patients are going to do what they want as well. So yeah, it is interesting. What do you think?
Um, I want to find a way to combine the two, if that makes any sense. Of course, we all know that with the recreational market is self-medicating. Majority of them are self-medicating, and so we do want to um, be able to have a smoother transition for them. But we also do need to recognize that there are people that are not in the recreational market and are cannabis naive and would want to come into it. And also, if we want to encourage a growth with the healthcare sector, full stop, names like Gorilla Glue, it's just not going to work. It's at all. So I wonder if there's a way where, and I suppose this is where, because my suggestion basically is not legal, which is have a different name, but still have a list online where you can explain this is that strain, that is that strain, that is that strain. However, we're not allowed to have these lists online. So,
Yeah, it's yeah, that is one of the things that I come across a lot, by focusing a lot on like medical cannabis regulations and marketing. Um, Product name is one of the things you definitely cannot say from my my point of view. Um, so yeah, it is interesting. I do agree that I think if it is to be reimbursed by the NHS or included more in the NHS, that the models, those two models of prescribing, don't really fit together. So yeah, I do think a sort of nice middle would be a good idea, where patients should be able to access the information somehow. Um, Maybe sort of in small on the back, instead of large on the front.
It's I just find it sad that we have to go through these extremes in the first place. There is no other medication that you have to go through. And I get it, yeah, schedule two, yeah, blah blah blah. We've all heard the story, but at the end of the day, I think I saw a post today that said there's about 36,000 patients, because I think there's always been a estimation around between 32 and 35, but I've seen 36 now. And that's 36,000 people that are on this medication. Like, it's, and it is low, but it's still 36,000 people. So do our rights not count in this? Like, why aren't we allowed to? Well, as a patient, I know I can speak about it, but there's just so many barriers in place for industries who are trying to reach out to more and more patients so that we can support them. And no, I'm gonna go on a rant again. I can feel it.
That's okay. Yeah, I completely agree. From based on that, I agree. There's so many barriers, and I do personally think that it's partially on purpose. Yeah,
100%. 100%. Don't even get me started on the government.
there's education that needs to be done with police, with social services, with the healthcare system, with all of these different actors that need to be educated, and there's a lot of barriers on the industry from doing that. For example, I would love to be able to go to the police and offer education about medical cannabis, but it would be classed as cannabis marketing because of the company I work for. So there's a lot of barriers to achieving better lives for patients. But I do think that there are ways around it, and through sort of lobbying and putting some of the best heads together, which I do think people in the cannabis industry are incredibly smart and dedicated, and a lot of them they come from so many different backgrounds. That's what I've seen in both patients and people in the industry, researchers. They say, oh, I did design, I came from finance, I came from music even, and just so many different areas, all sort of united by having passion for one plant, which is really inspirational.
That is a perfect note to leave it on. Josephine, thank you so much for coming in and for this very captivating um, discussion. Like, I loved it. We definitely will have you back on for season two.
Thank you so much. Thanks, Berta. Bye.
Thank you. For anybody that is interested in any more work that Josephine is doing, all of the links will be in the description section. Josephine, thank you again so much for coming down here. And we look forward to seeing everyone next week where we continue to discuss medical cannabis health. Thanks again.